We also respectfully acknowledge our debt to the labor of many peoples who contributed to the building of this nation. We acknowledge the enslaved people, primarily of African descent, whose labor and suffering built and grew the economy and infrastructure of this nation, and that slavery's ongoing impacts are still felt by countless people. We also acknowledge our collective debt to the indigenous peoples of this land, whose labor was forced and exploited, the Chinese immigrants who built railroads that allowed for westward American development, Japanese Americans whose properties and livelihoods were taken for them while incarcerated during World War II, and we recognize the immigrant and American-born workers of African, Asian, and Central and South American descent, whose often unseen labor has and continues to contribute to the well-being of our collective community. Today's webinar is the first in our 2025 Climate and Health Equity webinar series as part of the Climate and Health Equity Fellowship Program. Also known as CHEF, the CHEF program recognizes the need for more climate and health leadership and a sharper focus on equitable climate solutions. The goal of the fellowship is to educate physicians from populations that face greater burdens from climate effects and are underrepresented in medicine to become leaders in climate and health equity, education, advocacy, and policy solutions. I'm Dr. Shanita Johnson, Director of the Climate and Health Equity Fellowship. Also joining me from the consortium to run this webinar are Dr. Vernice Curry, the Associate Director of the Fellowship, Dr. Kimberly Williams, and Clarissa Payton, our CHEF Program Assistant. Clarissa will be available through the chat to answer any technical questions during the webinar. The webinar series is hosted by the Medical Society Consortium and Climate and Health. We will put this link in the chat. It is held for 1 hour on the second Friday of each month from 3 p.m. to 4 p.m. Eastern Standard Time. Today's webinar will be recorded and made available on our YouTube channel and website for future viewing as part of the Climate and Health Equity webinar series page on our website. When considering the impacts of climate change through the lens of equity, it is vital to understand the dynamics of communities most at risk and the role physicians and healthcare professionals can play in community resilience and ensuring the health of community members. Recognizing the challenges and opportunities within our communities allows us to take meaningful collaborative action. Today, we are truly honored to have luminaries in this work speak as the speakers of our webinar. Our first speaker will be Almeta Cooper, National Manager for Health Justice at Moms Clean Air Force. And our second speaker will be Vernice Miller-Travis, Executive Vice President and Environmental Justice Lead at Metropolitan Group and co-founder of We Act for Environmental Justice. Rather than using our time to provide a further description of their impressive work, we are placing a link to their bios in the chat. The general format for today's webinar will be 2 20-minute presentations by our speakers, followed by questions and answers from our audience. We ask that you please put comments, links to any resources that you may recommend, or any questions you may have for the presenters in the chat box at any time during this presentation. We will get to as many of the questions as we can during our Q&A period. Please also remember to keep yourself muted so we are not interrupted by background noise. Almeta, please begin.
Hello, everyone. It's a pleasure to be with you. I'm excited to be with the fellows and excited for your journey and the knowledge that you'll be gaining as you're a part of this program, and glad to be part of the first program for this year. Clarissa is going to advance the slides for me, and we can go to the first slide. The name of this program is Awareness to Action regarding sustainable communities. And whenever I speak to audiences, one of the things that the message or the takeaway that I like every audience to have about climate and about health is that the first thing that we have to do is to be informed. And if you're a healthcare professional, you can also facilitate in helping that those people that you treat and work with as well are also informed. And that's part of what we're doing today, is to help each other to be informed. And then there's a lot of research that's been done by the Yale Center for Climate Communications and the George Mason University Center for Climate Communications on the fact that while the majority of people in this country understand and accept that there is climate change, the climate is changing, one of the greatest barriers to really being able to do anything about climate change is that people are not talking about it. There's just a lack of awareness. So I'm always excited to be a part of an effort that spreads knowledge and motivates people to be engaged and to do the last thing that's on this slide, and that is to take action. I'm going to talk a little bit more about in this brief opening presentation about what take action means. But being a part of this discussion today is obviously the first step in taking action. So next slide. As healthcare professionals, probably most of the people who are within the sound of my voice are really aware of air pollution and how it can harm whether you're a child or an adult. And then there's just many, many ways. This slide, which the American Lung Association has put together, is just a nice kind of quick, high-level discussion of things so that when you're talking with people and they ask you the question, what is the connection between health and air pollution? Well, depending on the time of year, and for many of us, we're about to enter that part of the year where respiratory problems are really quite difficult in some urban areas. But the wheezing, coughing, shortness of breath, asthma attacks, worsening COPD, lung cancer are all part of the respiratory issues that people face. Many of you know that around the country right now that there is just a number of different flus that are going around. A lot of people are kind of, down with the flu, as they say. But there are other, also very serious impacts from air pollution, premature death, susceptibility to infections, heart attacks, strokes, impaired cognitive function, metabolic disorders, preterm and low birth weight. And a lot of people just don't know that. So even if you can just communicate to your patients or to others that you come in contact about these easy to understand, highly connected to air pollution, adverse impacts, it's really an important first step to being informed. Next slide. Now, I'm not going to read all of the things that are on this slide. It's very dense, and I think it probably goes against all the rules about what you're supposed to have on a slide. But particularly since we're in the 50th year of the Clean Air Act, and particularly because in currently what we're seeing is even from the current head of the EPA, and what sounds like an intention to completely decimate the Clean Air Act, which is supposed to be the vehicle by which we are protected, whether we're children, pregnant people, those who are 65 or older, or any member of the general population. The Clean Air Act is supposed to protect our air, our water, and help us to be able to live in healthy communities. What we know is that, again, going back to the be informed part of this, is that a lot of people are really not aware that not everyone is affected the same by air pollution and by climate change, and that people who live closer to highways, who live in urban heat islands, who live near plants and facilities or orphan wells are going to have more health effects and more illnesses than others. And it unfortunately happens to be that the people who are living in these types of communities tend to be people from under-resourced communities, some low-income communities, Black and brown people who are most affected by all of these negative impacts. The American Lung Association has a wealth of information on its website, and I commend to you that every year the American Lung Association does a general state of the air for the entire country. You can go to the website, you can look up your community, you can see what the air quality is. Also, the sad thing, and is noted here on this slide, is that in 2023, 1 in 3 people breathed air that earned an F in the state of the air. So even though in some places we're doing much better than we did in the past, it's really concerning that this number and this proportion of people who have very poor air quality. So there's a lot, and the point that I'm trying to make with this slide is, well, we already know a lot about poor air quality and how it's affecting people. And if we just act on what we already know, that will certainly be a good start. Next slide. As was mentioned in my introduction, I am a part of Moms Clean Air Force. Moms Clean Air Force is a national organization of about 1.5 million moms, dads, and caregivers. And we are really focused on protecting clean air and children's health. If you are active in social media, you probably have seen recently, whether it's Blue Sky, Instagram, TikTok, or X, that we have really been speaking up about our deep concerns about what's happening in terms of policy and regulations under the new administration. In terms of our general national priorities, Moms is known to be mom partisan, meaning we work with Republicans, Democrats, Independents, with any congressional champions for clean air and for people who, like us, believe in evidence-based, scientific-based knowledge of what's happening with our environment and with our air. We have historically particularly worked with EPA because of their leadership role or their responsibility to enforce the Clean Air Act. So oil and gas operations, soot, power plants, mercury, petrochemical facilities, and vehicles, all of which have the potential to harm health if when we're talking about fossil fuel powered vehicles in particular and emissions. We have always spoken up at hearings, made comments on rules that were proposed. And again, we have been very vocal in terms of what we're hearing about potential rollbacks from the current administrator. We also have a number of state and local initiatives. We have programs like our Moms and Mayors program. And we also have been really focused on trying to raise awareness about a very insidious campaign that's been going on called advanced recycling, which is not any kind of recycling. It's not advanced at all. It is really another way for the plastics industry to burn plastic and reuse it, and using some of the most toxic and some with the resulting in some of the most toxic byproducts that you can imagine. So we have been working very diligently to raise awareness again about the fact that not be fooled just because someone uses a word that sounds environmentally friendly doesn't mean it really is. You have to find out the facts, you have to be informed, and do everything you can to make sure that that these types of rules, and there's unfortunately 33 states that have some type of state law that supports advanced recycling, because people, state officials voted for these laws, not understanding or not fully understanding that it was really just plastic burning. We also have, as a part of the work that we do, we focus on justice in every breath. And we have programs that focus on maternal and child health. We work with the several tribal nations, particularly as it relates to their funding for their air quality programs. And we have a part of our organization that is focused on the Spanish-speaking members, and we have quite a few of our materials which are both in English and Spanish. If you go to our website, which is www.momscleanairforce.org, www.momscleanairforce.org, you can find we have a wealth of resources and fact sheets. And in addition to these priorities that are listed on the slide, we also engage as needed in urgent national campaigns, meaning that we have petitions that we solicit our members to sign and communicate with agencies and with elected officials to let them know about the concerns of our members about clean air and about children's health and any issues that are related to that. Next slide. One of the things that we are hearing from so many people in this time of just in the last 2 months, where we've been inundated with so many different executive orders and so many different changes of policy in various federal agencies in particular, the question is, what can I do? And what I want to say to you and to anyone that you know who asks you that question, well, first thing you can do is become a member. You can become a member of the Medical Society Consortium on Climate and Health. There are many state-related organizations for physicians related to the Medical Society. You can join Moms Clean Air Force, again, at www.momscleanairforce.org, or any climate organization or any group that has similar interests and who are trying to make sure that we can protect our planet and that we can be healthy. And here's a really simple, concrete thing you can do right now with all that is going on. It's so much that a lot of people say, oh, how can I even keep up with it? But for the things that you know something about, call your elected officials, call your congresspeople, your senators, your representatives, and let them know that you are not happy with all of these things that are being done that are adverse to protecting our planet and protecting our health. Most Congress people keep up with, in fact, all keep up with the calls that they receive. You can also email them, and if you're so inclined, you can write them a letter. But the quickest, easiest way, and a way that we know that they keep track of, is to call and let them know. And unfortunately, there's something happening every day, every week at this time. So calling every week is something that's doable and accessible, and tell all your friends and family to do the same. But not just Congress. One of the things that Moms does is that we encourage people to be in contact with their elected officials at any level. So school boards, they're critical to the fact that the Clean School Bus Program is in jeopardy, that has been getting over 8,000 electric school buses on the road since it was started 2 years ago. Contact your mayor, your city manager, your city council, especially because people in this group, they're your neighbors. They're real people who, when they are confronted by their constituents, by people who vote and who care enough to communicate on these issues, are likely to be responsive. Not always, but at least they can know that you are interested, and if you're interested, you're also likely to vote. So they're going to be most likely very receptive to what you have to say. And then also, I alluded to earlier to various state and federal agencies as they are adopting rules or retrenching on rules, to let them know what your position is on their rules and regulations. Next slide. So again, this is a very dense slide, and I'm not going to go through everything that's on here. But what I would encourage you to do when you have a moment is to access some of these social media messages that Moms is distributing as part of our outreach, to let our membership know, to let all people know, and to let elected officials know about our deep concerns about what is happening right now in terms of the many regulatory retrenchments that are occurring, attempts to roll back even the most fundamental parts of enforcing the Clean Air Act. And as you can see, if you take a moment and you look through this list, we're on YouTube, we're on like as I said before, Blue Sky, TikTok, and X. And what we're finding is that so many people don't have even a basic understanding of some of these issues. So we have been doing explainer videos so that people can understand what the EPA is. What does it mean if there's an endangerment finding? And we have also reached out to certain climate influencers to help leverage these messages because of their reach and their ability to make so many other people aware. So take a moment and read some of our public statements about what's going on in terms of the climate and actions that are against preserving clean air, because I think you will find them very helpful. We really focus on getting out messages that are simple and use plain language. We are not physicians, we are not scientists, as in some other organizations that do have those that expertise, but we do have access to facts, and we make them available to others who are looking at our messages. Next slide. Here is a really important message, and it's from this book by Timothy Snyder about tyranny, and he has 20 suggestions. It's a very short book. It's only about 100 pages about what you can do, because in this time of despair, when you're trying to think, what can I do? Well, here's 3 simple things that you can do. Do not obey in advance, meaning don't get so overwhelmed that you don't listen to any news, you don't talk to anyone you know about the things that are going on, and so that you start to retrench yourself and not resist against some of these actions that are being taken that you oppose. And I know that many of you as health professionals have very demanding schedules, and you may not have time to leave your office and your patients, but you can contribute to good causes. So there are a lot of people in addition to Moms Clean Air Force, in addition to the Medical Society Consortium on Climate and Health, who are trying to raise awareness and encourage people to take action. Another thing that you can do, and in whatever amount, is contribute to good causes. And then last but not least, just be as courageous as you can. You know what your level of courageousness is, but be as courageous as you can. So these are some of the things that you can do to take action. Next slide. This is my contact information, and we're going to be coming back for more questions later after my dear colleague has a chance to give you some remarks. So I'm going to be quiet now until she talks, and then the 2 of us will be available to respond to questions.
Thank you so much for that informative and valuable presentation. And we're going to switch over to Vernice Miller-Travis. You may begin, please.
A hearty thank you to the Medical Society Consortium for Climate and Health and to the Chef Fellows. It is a pleasure to be here with you this afternoon. Almeta, thank you for that wonderful presentation and lead in. I especially loved that next to last slide about what we can do at this moment. So I'm first going to talk about sort of putting this work and my work in a personal context and how I came to be doing this work and some really important findings around fine particle pollution and the health impacts on the community that I'm from in New York, the historic Harlem community. And then I'm going to switch over to talk about some of the slides that we see on the screen, or the presentation that we see on the screen. So first, I am from the Harlem community in New York City, born and raised, educated in the community at Barnard College and Columbia University. And I moved there. I moved here in Prince George's County, Maryland, just east of Washington, D.C., almost 28 years ago. And a lot of the work that I do in the field of environmental justice is from the perspective of living in that community, growing up in that community, and starting a nonprofit organization, We Act for Environmental Justice, or we began our journey as West Harlem Environmental Action. And we originally came together as community residents to fight the siting of a giant sewage treatment plant that the city of New York was being encouraged, and that's not a strong enough word, really pushed by the Environmental Protection Agency in the early 1970s to help clean up the Hudson River by building a sewage treatment plant, a wastewater treatment plant that would filter all of the wastewater and raw sewage that was generated on the entire west side of Manhattan. It had been going directly into the Hudson River since the founding of the city back in the 1600s, right? And so the river, when I was growing up in New York, the Hudson River was a dead ecological zone, the lower Hudson River, along New York City and bordering New York and northern New Jersey. And there were no fish of any kind. There were no plankton. There were no seagrasses. There was nothing that was able to live, a living organism in that river, that great majestic body of water, when I was growing up in New York City in the 1960s. And so once the Clean Water Act was passed, there was a real urgency to really begin to treat all the waste and all the effluent and all the sources of contamination that were going into our river streams, oceans, and waterways. And so this was the task for the city of New York. Originally, they were going to build this sewage treatment plant that was designed to treat 180 million gallons of raw sewage and wastewater a day. They were going to build it south of our community, roughly on 79th Street. For those of you who know anything about New York, that's the Upper West Side. But they determined one of the great, or I wouldn't call him great, but certainly one of the most well-known city planners of New York City was a man named Robert Caro. I'm sorry, it'll come to me, but there's a great book that Robert Caro wrote about him called The Power Broker. And he determined he was going to build this cultural center called the Lincoln Center. And he determined that we couldn't have a sewage treatment plant anywhere near the Lincoln Center. And it was going to be on the river about a mile and a half behind Lincoln Center. And so they looked for another location of where to build this sewage treatment plant. And they decided to build it adjacent to the West Harlem community. The West Harlem community is that place in the Harlem Renaissance literature that is often referred to as Sugar Hill. Sugar Hill is a real place in Harlem with a lot of middle class residents, brownstones, wonderful homes, wonderful architecture, wonderful art, lots of great, great, great people, including many writers of the Harlem Renaissance, lived in that part of the community. And it bordered the great Hudson River. And so it was really a wonderful place to live. And I remember being a child and my dad and I walking from where we lived in central Harlem over to the river, which was about a mile and a half, 2 mile walk. And just thinking to myself as a child, one day I'm going to live over here in West Harlem. I'm going to live over here in Sugar Hill, because it was just such a beautiful part of our community. Well, move forward to the late 1970s, and the city of New York and the state of New York and EPA Region 2 decides to start building this sewage treatment plant. And they decide that they're going to build it in our community. And the community really rose up and tried to fight back with every lever of power and influence it had. But we were no match for three branches of government deciding that this was the appropriate location for this facility. And again, it's treating 180 million gallons of raw sewage and wastewater every single day. Well, in order to meet the date by which this plant needed to go online, as determined by US EPA, the city of New York took a number of design shortcuts to try and get the construction of the plant and the operation of the plant, at least in primary treatment, operating by a date certain. And one of the design elements that they decided to skip was odor control devices, any odor control devices. And so if you can imagine in your mind 180 million gallons of raw sewage and wastewater flowing through this plant, being held in holding tanks that had no cover on the top of them, and what that experience was like for the 100,000 people that lived in close proximity to this plant. We smelled the odor of fetid raw sewage every day, 24 hours a day, for 8 years, 8 unceasing years. And when I say smelled the odor of raw sewage, so imagine you're in a public place, you're in an airport or in a bus terminal or some public facility, and you go to the bathroom and one of the stalls is backed up. And you know how unpleasant an experience that is. Try and imagine, if you can, magnifying that by 180 million gallons a day. It turned our community into a giant toilet bowl, and it was deathly unpleasant. The odor was literally breathtaking. So we began to have these public meetings with our community residents every fourth Wednesday of the month. And we had our regulators come. Our regulators included the State of New York Department of Environmental Conservation, the City of New York Department of Environmental Protection, and EPA Region 2's Air Division. And no matter what we said, or no matter how we talked to these regulators, we were completely dismissed about what our lived experience was. And we were trying to get the community to focus on what did we need to do to get all these regulators to do their utmost to really fix this issue of odor, of odor that was overtaking our homes, overtaking our recreational facilities, overtaking the small businesses, overtaking what recreational spaces we had. It just was an unbelievable experience. So we were not successful in that vein, but every time the community would come together and hundreds of people would turn out for our public meetings, people would talk about asthma. And we wanted them to talk about the sewage treatment plant. We wanted them to focus on the odor. They wanted to focus on asthma. And no matter what we said, no matter who we brought to the meetings, this was the sole focus of the community. So at a certain point, I reached out to a colleague of mine, a former classmate of mine at Columbia University. He was an undergrad at Columbia College. I was an undergrad at Barnard College. And the woman that he married was a classmate of mine. And he was, by then, had gone on to the College of Physicians and Surgeons at Columbia University, had become a physician, and he was a attending resident in the pulmonary medicine clinic at Harlem Hospital. Harlem Hospital is in Central Harlem, the next neighborhood over. My mother was a pediatric nurse there. My father worked there. I was born at that hospital. And I explained to him, his name is Dr. Jean Ford, and I explained to Jean what was happening. And I said, we can't seem to penetrate this concern that the community has about asthma. So we need to figure out and get our arms around what's going on. And he said, well, wow, isn't that coincidental? He said, we just applied for a research grant from the National Institutes of Environmental Health Sciences to do a household asthma survey in the Harlem community. And I said, well, what made you all decide that you wanted to do that? He said, because the preponderance of patients that we're getting into the hospital in the emergency room, that we're admitting, every age category from asthma is really overwhelming. And we recognize that there's something amiss and we really need to get our hands around it. And so we're going to do this household asthma survey. And I said, well, how many households do you have in your study area that are in West Harlem? That's the part of Harlem that we lived in that was adjacent to the sewage treatment plant. And he said, well, we don't really have any households there because we're focused on Central Harlem, which was more of the service area of the patient clientele that Harlem Hospital treated. And I said, well, most of the sources of ambient pollution are on the west side. And I think it would give more depth to your research if you included households in the west side of the community. And so they decided to do that. In the meantime, we are having this unbelievable back and forth with EPA. So I should say, I might have skipped over this, that there's a part of the National Environmental Policy Act that whenever a facility is being built that has a national import and is part of the federal government. So sewage treatment plants are regulated by the Environmental Protection Agency, that under the National Environmental Policy Act, you have to do an analysis of the impact of the facility on the nearby population. And you can look wide, you can look narrowly, you can look at an adjacent residential areas or areas. You can do any number of ways of doing that analysis. But for some reason, the Environmental Protection Agency, when they were doing that original analysis, and this is before the plant was fully constructed and operational, they decided to give the plant 2 findings of no significant impact. So that is an actual designation under the National Environmental Policy Act that you think that the import of this facility, it could be an airport, it could be a seaport, it could be a train station, it could be a sewage treatment plant, it could be any number of things, but you determine that the operation of that facility is of such great import that it will not have significant impact on residential populations, or it's not important to determine that at this time. That what's more important is the overall goal. And so the overall goal was to begin to clean up the quality of the water of the Hudson River. And that was the far more important element for the Environmental Protection Agency, not whether or not we could breathe, not whether or not our air quality would be greatly diminished, but that was the main import. So they start to build in a sewage treatment plant. We have no odor control devices. The plant goes online for primary treatment in 1986, and our lives were forever changed. And you would know when you were getting anywhere near our community because you would start to smell the overwhelming odor of fetid raw sewage. So as a way to placate the community residents, the state of New York decided that they would build a park on top of the sewage treatment plant. It's called the Riverbank State Park. It's about 30 acres in size. The plant itself cost $1.1 billion to construct. The park atop the plant cost another $130 million to construct. Now, the park is magnificent as recreational facilities go. It's got a skating rink. It's got an indoor and outdoor Olympic-sized swimming pool, soccer fields, football fields, baseball fields, a restaurant, a carousel, a community center, garden plots, blah, 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 blah. On top of 180 million raw gallons of wastewater and sewage every day. So I think you can imagine for yourselves, who in God's name would build a park on top of a sewage treatment plant? And who would build it on top of a sewage treatment plant that didn't work properly and that smelled like a giant malfunctioning open sewer pit? Who would do that? And why would you think that in so doing and using public dollars to do that, that would make the people in the community happy and it would somehow make the issues around the odor and the air pollution go away? So that's happening. We got this research study going on with the Harlem Hospital Pulmonary Medicine Department, as well as the Columbia University Mailman School of Health, Division of Environmental Health Sciences, of which Jean was an adjunct professor at while he was an attending physician at Harlem Hospital. And we have all of this going on. And so fast forward a few years, and I am invited to address the annual meeting of all the state Environmental Regulatory Agency's air division directors. They meet 3-4 times a year. And I was invited to talk to them about a new civil rights policy that had been instituted by US EPA. And I was there with the assistant administrator for the Office of Air and Radiation at EPA, whose name I will recall in a minute. And so we're giving this presentation, and I'm telling them exactly the same case study that I'm sharing with you, I'm sharing with them. This was in 1996. And this guy gets up after I give my presentation, and he says, Vernice, what do you need? This Black guy, one of the few Black people in the space besides me. And he says, Vernice, what do you need? After I've talked to him, same presentation I just gave you. And I said, I almost don't understand the question. What do you mean? What do I need? He said, what do you need to resolve the issues? And so I lean over to my colleague, Rob Brenner. That's his name. He was the former assistant administrator for the Office of Air and Radiation at EPA headquarters. And I lean over to Rob and I say to him, who is this dude? And Rob leans back over to me and he says, that's the Air Division Director for EPA Region 2. You know, it's his people who come up to your meetings every month that you all blow out the room. Those are his staff members. And I said, well, isn't that interesting? He said, so if he's asking you, what do you need? Answer the question, because he's the person who can do something about it. So I'm thinking as I'm talking to him and we're having this dialogue in front of all these people, I said, I don't know. We need air monitors and mobile air monitors. And he said, how many do you need? I said, I don't know, 50, 60, 65. And he says, okay, so let's do this. I'll get you the air monitors. You organize the community. And we're going to have a conversation about where do the community residents think the air monitors need to go. So we have these meetings. He comes through big time. He does exactly what he says he's going to do. They deploy the monitors. These are EPA's mobile monitors, calculated and engineered by EPA. So the data is data that can speak to EPA. And this is what we find out after about 6 months of the monitors operating in the West Harlem community. We find out that we have the highest rate of exposure to fine particle pollution, PM 2.5, of any community in the United States of America. We have the highest incidence of asthma of any community in the United States of America, and we have the highest rate of death, premature death from asthma, of any community in the United States. Without that data, we would not have been able to answer that question. But the people in our community knew that something was terribly wrong, because almost every household had someone in it who had either asthma or some other chronic obstructive respiratory disease or some respiratory condition. But what really floored me when we began to pull down this data was that the state of New York Department of Health and the city of New York Department of Health must have known what was going on in our community. How do I know that? Because you all know, as physicians, as doctors, as folks in the medical profession, that whenever somebody dies anywhere in the United States, the county in which they die has to list on their death certificate what they died from. So both the state of New York and the city of New York know that there is an asthma epidemic and a crisis of premature death from asthma that's happening in our community. And no one ever said anything to us. No one ever came to us. No one ever came to meet with us. No one said anything. And it had not been for me knowing this physician who was my former college classmate and reaching out to him, and him being a part of the Mailman School of Public Health, and this fortuitous meeting with the Air Division Director at EPA, we may never have found this out, but yet we would have continued to suffer. So I tell you that simply to say that, one, what are the lessons? Listen to the people. When people say they are in harm's way, when people say that they are suffering, listen to them and help them try to figure out and go back and put those puzzle pieces together. This is what's happening to us. This is what our challenge is. And then figure out a way that you can help them. And all of us have an ability and a way to be able to help people in some way, shape, fashion, or form. We should have listened to our own residents, and we didn't. For the longest time, we kept wanting to talk about the odor at the sewage treatment plant. The sewage treatment plant was a big problem, but it was not the main problem that was triggering the excessive exposure to fine particle pollution, PM 2.5. So that's the lesson that I've taken from the rest of my life, for all of my career, for all of the work that I've done. This is the principal lesson for me: the power of data to validate people's lived experience and to change policy. I'm so happy to be able to tell you we are now, we haven't been for years, the #1 driver of asthma, the exposure to asthma, the incidence of asthma, and premature death from asthma, because we had these other partners that we galvanized to help us work on what we needed to do to change policy, mostly around transportation planning and the concentration of different sources of transportation: highways, byways, bus depots, commercial corridors through the community, truck routes, etc. We dealt with all of that over a number of years so that our community could be healthy and could thrive. How many minutes do I have left, Clarissa?
We are just about at time. Maybe
Okay.
1 minute to close.
Okay, so I'm going to go to one thing. Clarissa, come with me to slide 9. So as a result of all of this work that I've done over almost 40 years, a part of what I do professionally is communication, and communication around what is important. So I want to share with you this message framework that my colleagues and I developed for the Kresge Foundation's Climate Change, Health, and Equity Initiative. And this is an important framing. We tried to figure out, how could people working at the grassroots and community level, how could they help to drive climate policy even when they're working in places where the political geography is conservative, it's maybe hostile, but yet they're still trying to move climate policy? And we came up with these 3 framings: health equity, prosperity, and safety. These are the 3 things that every community wants, no matter where they live, no matter their station, economic station, no matter their educational levels of attainment, no matter what. These are 3 core principles that folks, every community needs. And we built a whole message framework out of this for the Kresge Foundation's Climate Change, Health, and Equity grantees. Can we go to slide 11? And this is what it comes out to when you're talking to folks and you're trying to get them on board with you in terms of trying to work on climate issues. You want to make a call to action, to ask people to join and come together to make their communities safer, healthier, stronger, and less vulnerable to the effects of our changing climate, so everyone has the opportunity to thrive. And also that all of us, all members of our community, businesses, hospitals, nonprofits, faith-based organizations, and more, must work together to adapt and to respond to the growing dangers around us due to climate change and the climate crisis. You would not believe how effective this message has been to really expanding the tent of people who care about this issue. Not because we're spewing dogma about climate change, but because people want to be healthy, they want to be safe, and they want to prosper. Prosper doesn't mean excessive amounts of wealth. Prosper means having the ability to have access to health care, to be able to pay for whatever medication, that your family has access to health, safe food, safe housing, safe neighborhoods. Prosperity means that people are safe and they can thrive where they live. I learned that from my community at home in New York, and I try to bring that message forward to other communities around the country. Thank you so very much.
Hey, Vernice,
so
this is
much.
Almeta. I just wanted to emphasize something that you were just saying. Even though in the message that they use in their community, health equity was one of the core principles. When you were looking at that last slide, most people really don't know what health equity means, but they understand what fairness is. So when you're communicating with people, and it goes back to what Vernice was saying about you have to meet people where they are. You want to be able to use language that really is meaningful to them. Because again, while this audience, we understand what health equity is, most people there, just really don't have a deep understanding of what that means, but they do understand what fairness means. And, Dr. Kamara Jones, who is credited with, being the person who really came up with the definition of health equity. Health equity means that people receive the health care that they need when they need it.
Maybe. And
So,
if I had shown you another slide, fairness was one of the words around which we have framed that message framework, that everybody wants to be treated fairly and justly, right?
yeah.
So thank you for that, Almeta. That's exactly 100% where we landed as well.
Thank you both for these powerful talks and for sharing your story and the work that you're doing in the communities that impact the health of these communities. We will open up for Q&As. You can raise your hand or put your question in the chat. I have one question here that says, what areas did you put the air monitors? How did you deliver the data to the community? And did they assist with the community solutions?
Yes. So yes to all, to two of those questions. And in terms of where we put the air monitors, we put them in areas all around the community. We put them on top of apartment buildings. We put them at street level. We put them in neighborhood gathering spots. We put them along the main corridors of transportation. We put them by schools. We put them one middle school is directly across the street from a bus depot. We put the monitors there at the middle school. We put them in places where community members said, we think that you will get a better sense of what is actually happening here in terms of pollution and air pollution if you place the monitors thus and so. So the community members picked the spots, and EPA put those monitors exactly where community members said they should go. We pulled that data down on a regular basis. We always reported out to our community members about what the data was telling us. We had folks from Harlem Hospital and the Mailman School of Public Health working with us to be able to communicate and translate what the data meant. And we just kept that conversation going for years. We met the fourth Wednesday of every month for at least a dozen years. And so people knew that they could come to us, they could get that information. And today we have a whole community health, a health training program that folks and residents in the community can participate in to build their knowledge, but also so that they could go out and do advocacy in their own parts of the community or among their family members. So we just kept giving that data to folks. And West Harlem Environmental Action, or We Act for Environmental Justice, we still do a lot of data-driven analysis. We just did a great storyboard around how air pollution continues to affect differentially different communities in New York City. So we still believe in the power of data.
Vernice, I know someone has a question, but I just wanted, just for the audience, I think it'd be helpful. The air quality monitors that were used, were those the EPA?
Yes, they were EPA's
monitors?
own monitors.
Because
Yes.
that, in some communities, that's a challenge because of how expensive they are, and
Well, yeah. And there's all kinds of air monitors, right? I think that's what Almeta is getting at.
Yeah.
There's purple monitors, there's monitors you can put in backpacks, there's all kinds of monitors. We just happened to get lucky that I was in this conversation and the air division director for EPA Region 2 happened to be there. And he realized, I think the reason that he responded the way he did is because he realized there was something simple that EPA could have done to help us get our arms around the project, and that is to put monitors out there so we could see what the ambient emissions were and what the exposures were like. And we also recognize, Almeta, that God only knows how much each one of those monitors cost. And we did not have to bear that cost. But there are all kinds of monitors that are available that people can use and begin to collect data about what's happening in their communities. You don't just have to use EPA's own technology.
To ask the last question from Dr. Safety and Dr. Callens, we will get to your question in the session following this. Dr. Safety says, as an occasional visitor to New York City, Riverside Park doesn't have the odor problem that it used to have, at least in some areas. Was there a solution, or does the odor problem persist in some areas?
There was a solution, and first of all, the solution was to monitor properly, right? Actual odor control pieces within the facility itself, but also there's been methane recapture, so that the plant also used to flare methane and burn methane through a really big stack. That went on for a number of years, but they've since put in a methane recapture system and used some of that methane that they're recapturing to power the plant itself. They're doing a much better job on odor control. And just the design of the plant, there was literally no odor control technology whatsoever for the first 10 years of the life of the plant. And they went back in and re-engineered the plant to put those things in. And so just focusing on the problem and trying to resolve the problem led them to some solutions. But they did do a lot of things. They spent, I think we sued the city of New York. I might have forgotten to say that. And when we settled the lawsuit, we settled it for $1.1 million that came to our community-based organization and 55 million capital dollars to fix the odor control and install the odor control systems at the plant. So they spent another 55 million on top of the 1.1 billion to construct it in the first place. Of course, it would have been a lot easier and more cost effective if they had just done that in the first place.
Thank you so much, both of you. I know this discussion can go on much longer, but we have to wrap up. I would like to thank our speakers for their fantastic presentations, and I thank all of you for participating in our webinar series. I hope that you found it useful and engaging. As a reminder, these webinars are held on the second Friday of the month, and our next webinar will be April 11th at this time, and will cover extreme heat. Before you leave, we ask you to take a moment to complete the webinar survey. If you haven't already, the link is being placed in the chat. And this now concludes our session. Have a wonderful day and weekend.